problems, the issues of fibromyalgia, so I'm going to get into another big one today that may be causing flare-ups for you. So how many of you have experienced an increase in pain or maybe even a full-fledged flare-up when you exercise? Now, this is a big one, right? You want to be healthy. Maybe you want exercise for weight loss, but then finally you get up enough energy to do it and then you crash. Sometimes you crash so hard from the pain and fatigue that it makes you never want to do it ever again. Now, I've spoken to a lot of fibro warriors, and this is a huge and frustrating issue. It can lead to so much internal frustration and even a feeling of hopelessness. So let's delve into it. Well, let's look at what's happening here. Now, there are a few big pieces to this. Now, a big one and the big topic that I've been talking about most recently, this is our fourth stage in addressing fibromyalgia, is circulation. Now, poor circulation specifically. Now, when circulation isn't good, the body won't metabolize free radicals as well, and they can accumulate. Now, I'm sure you remember free radicals. They made a whole lot of headlines years ago, and then there was tons of companies that came out with miracle supplements to get rid of all the inflammation in your body and all this other stuff. And then we realized that they weren't doing as much as they were claiming. But these free radicals are inflammatory molecules, and our body produces them, and they're important to our survival. Now, however, when they accumulate, they tend to increase inflammation, which can, of course, lead to pain, can lead to tissue damage, and that can actually cause premature aging. Now, this especially becomes an issue when there's scar tissue in the body, like from old injuries. So if you've had, old knee injury or old hip injury, maybe you've had surgery, like on your knee or on your back, this will create scar tissue. Now, these areas with this scar tissue are already compromised. The circulation is already altered in these areas, and they tend to accumulate these free radicals. Now, when circulation is suddenly increased, like with exercise, these free radicals get basically kicked up into circulation, and they do what they do best. They cause inflammation. They cause nerve irritation and then subsequent pain. Now, if your circulation has been very poor, this may feel like a total flare-up, because now suddenly your whole body becomes inflamed and it just hurts, and it makes you tired. It makes you frustrated, right? Now, in people who have even worse circulation, now I'm talking about people who are further along in age, and they often will have things like varicose veins along with it, and varicose veins in their legs. Now, they can not only accumulate these free radicals, but they can also start to accumulate old and dead tissue. And this collects in the legs and in the feet like sediment settling down. It's basically a matter of gravity. Now, when the circulation suddenly gets increased here, of course, the free radicals will come up, but this dead tissue also gets kicked into circulation as well, and now the body's immune system will react. Now, this will cause a characteristic itchy feeling. Now, how many of you have complained about or have dealt with itchy skin on a regular basis, where it's just you feel itchy? This will cause that. Not only that, it can actually cause, in some cases, redness or even a temporary rash from your body's immune system, the macrophages, trying to get rid of this dead tissue that's not supposed to be there. So in cases like this, it's even more important that we improve circulation very gradually, because if you do it too quickly and you've got, say, all these varicose veins, if you improve circulation too quickly, it can actually make those veins worse, or it can actually make them very, very painful. I've seen this happen where people use a therapy that really increases circulation, and then their veins hurt like heck, and they'll throb and they'll be painful. Not only that, but then if you kicked up all these free radicals, your whole body starts to ache. Some people will even feel almost like a flu-like presentation with this. So this is one of the reasons we tend to focus on addressing other factors that will influence circulation first, because it allows the body to improve circulation gradually, and it tends to eliminate a lot of these extra inflammatory factors so that the process becomes easier. It becomes more smooth, more comfortable, and it allows the body to adapt and start to combat the inflammation on its own, as it's meant to do, as your body is supposed to do. So I hope that sheds some light on this.